Hey, I want to talk a second about pad placement when using an NMES device, which is neuromuscular electrical stim. Now, no secret that I'm a big fan of this technology. When I woke up out of surgery, one of the things that I wanted to do was be able to engage my quad right away. I wanted to make sure that I had connection between my brain and the tissues. Now, what we know is that swelling is going to definitely inhibit function massively, right? And also pain is going to inhibit function massively. So the more I can stay ahead of my swelling and manage my pain, the more I'm able to stay connected, which does a couple things for me. It allows me to keep my quad mass, allows me to have better earlier control over the system, et cetera, et cetera. But one of the things that we see a lot of is that when people get a device, here I'm using the H-Wave OTC for the first time, is they're like, where do I put the pads? You know, help me. Where's the guideline? And the rule of thumb is it all goes to the same place. So if I'm getting muscle contraction in any one of the tissues in my leg, it's going to be encouraging lymphatic drainage of the whole system. So if I'm trying to stay away from something, here I've just unbandaged myself so you can see the full glory of my incision here. This little tiny marks here, not here, these are just the sutures, the incisions over here. But if I was worried about pulling on an incision, I might stay away from it, and so that I wasn't just yanking on the incision all the time. So if I have something I'm trying to protect, move the pads away. That could be on my calves, that could be on my shin, that could be on my hamstrings, it could be high up in the quads. But where people still get in the weeds on this thing is that oftentimes, I'm going to put on some low pumping here, is that I can get a good contraction, and what you're seeing is, hey, that's an okay contraction. Well, what happens if I move the pad around? Oh, that's a little bit better contraction. What happens if I move it around still? Okay. What happens if I put it over here? All right, now we're rolling. So I just did something very sophisticated, which is called informed freestyling, which is let me move the pads around until I get the contraction I'm looking for. So we give people examples, and there are a ton of these on the internet about ideal pad placement. But keep in mind, you should be just putting the pads in a place where you can get massive contraction of the tissues you're trying to dump. In this situation, I'm trying to get some movement of my patella, that's great, and I'm trying to get some contraction of my quadriceps so that I can continue to decongest this leg, stay connected, right? All the movement is also telling my brain, hey, it's totally okay to flex your quadriceps and pull your kneecap because we're doing it and it's not painful. But I want to show you a ninja level kind of technique, because oftentimes, again, people get really confused about where they should be putting the pads. And what I want to show you is that it's absolutely okay, wait for it, to cross the spine. So if you're having a hard time picking up contraction because you're swollen or some other reason, go ahead and cross the spine, and you'll see that it's easy to pick up contraction. And there's probably some pretty cool phenomenon going on. The same way I train my left side, I'm training my right side. My brain is now thinking, hey, look what we're doing on this other side. But somehow, and this cross spine bilateral leg comes from the CEO of H-Wave. He's called and he's like, have you tried this yet? And I was like, that's great. But the idea here is that sometimes I can pick up contraction in tissues that may not be getting it if I was just staying on the tissues. I'm pretty congested right now, but look what happens when I cross the spine. Immediately I pick up a little bit more movement in this tissue. So what I'm telling you is two things. One, don't be afraid to play with your pad placement. It can kind of be what worked today may not work tomorrow. Areas where we have a neurovascular bundle, which means a nerve, artery, and vein, right around the head here. There's a lot of sort of nervous tissue system tissues behind the shin. You'll see that there are definitely places that tend to light up a little bit more, right, than just the good old-fashioned muscle bellies. But move around until you get a contraction. And don't be afraid to keep adjusting the pad. That's actually a sign that you're a pro. Secondarily, don't be afraid to cross the spine, because there's something about my nervous system picking up this connection. I get a little bit more of a contraction in tissues that may be congested or looking for a little bit more signal in order for the contraction to happen. So, in short, pad placement is all about art. And really, remember, the whole thing dumps to the heart eventually anyway. So let's go ahead and just keep in mind that pumping my calves works, pumping my shin works, hamstrings, groin, quads. The goal is to drain the leg. Hopefully that helps.